everyone. Thank you for joining today's special topic webinar, the Viral Hepatitis Education Program, presented by the American Liver Foundation. I'm Carla, the Director of Education and Partnerships at NeedyMeds. And before we get started, I'd like to go over a few tips so you can make the most out of today's presentation. If you do have questions, you can type them into that questions section of your GoToWebinar control panel. Just know that we will reserve answering questions until the end. If we don't have the time to answer your question, we will follow up with you by email. The contact information for both NeedyMeds and the American Liver Foundation will be provided. Also, this webinar is being recorded and will be posted on the NeedyMeds YouTube channel. And you can find copies of both of our PowerPoint slide decks in the handout section of your control panel. So let's get started with what is NeedyMeds. For those of you not yet familiar with us, what you're looking at on our screen is our mission statement, a statement about how we achieve our mission, and our vision statement. But simply put, NeedyMeds connects people to programs that will help them afford their healthcare expenses. And we do that free and anonymously through our website, needymeds.org, and our helpline. I always like to put up a screenshot of our homepage because our website is really the face of our organization, and it gives me a chance to point out a few resources. If you are looking for healthcare savings programs, you will find those under the Patient Savings tab. I mentioned that this webinar is being recorded and will be on our YouTube channel. You can find a link to that on the top right of our homepage. It's the third icon from the left. And to check out what other webinars are coming up and to register for them, visit the calendar of events on the bottom right-hand side of our homepage. So let's get into what you're all here for today, which is today's webinar, the Viral Hepatitis Education Program, presented by Lindsay Ventura, National Manager of Education and Outreach for the American Liver Foundation. So first, let me tell you just make a quick statement about what the American Liver Foundation is. Their mission is to promote education, advocacy, support services, and research for the prevention, treatment, and cure of liver disease. Now, let me tell you a little bit about Lindsay. Lindsay is, as I said, is the National Manager for Outreach and Education for the American Liver Foundation. She joined, and we call it the ALF, the American Liver Foundation. She joined the ALF as a Community Outreach and Education Manager for the New England Division in October of 2014. In that position, she orchestrated all educational and programmatic delivery for the ALF in Rhode Island, Massachusetts, New Hampshire, Vermont, and Maine. In her new position, Lindsay manages programming along the East Coast, develops content for the Liver Life blog, and many more national initiatives. Lindsay holds a Bachelor of Science degree in psychology with a minor in education from Northeastern University. And prior to joining the ALF, Lindsay worked as a research assistant for Brigham and Women's Hospital. And I will also mention that she's not only a pleasure to work with, but you'll see during her presentation, she'll share a ton of information, but she makes it very relatable and breaks it down into manageable, actionable, easy steps. So it is our pleasure to welcome her here today. And with that, and hopefully seamlessly, I'm going to pass the mic and the screen to Lindsay. And everybody, while Lindsay is grabbing that screen, remember that if you do have questions, you can feel free throughout the presentation by typing them at any time into that questions section of your GoToWebinar control panel. Thanks, Lindsay, and I'll pass it over to you.
Hi, thank you so much, Carla. I am going to share my webcam. I really enjoy kind of having a little bit of a face-to-face. Like many of us right now, I am working from home, so I'll apologize in advance. I have a cat and a dog who may get into a little trouble, but hopefully they'll keep their cool. So I am grateful to NeedyMeds for inviting the American Liver Foundation to once again partner on a webinar. Today we'll be speaking on viral hepatitis. So let's get started. Really, to talk about viral hepatitis, we first need to talk about what our liver does. Our liver is our largest internal organ. It weighs between 3.5 and 5 pounds. It's seated on the right side of your body, right up under your ribs, and goes almost all the way across your upper body, as you'll see here on this slide. It's responsible for over 500 different functions. The liver's biggest role is to be like a filter in a fish tank. Whatever you eat, drink, breathe, or absorb through your skin is processed by your liver. Your liver acts like a rechargeable battery. So as you eat, it stores up energy and nutrients you don't need right away. And then as you need them, it's going to let them back out. So it helps to build muscle. It also makes bile to digest food. So as you'll see from this image, we have, actually, I think I can do a little laser pointer. Here we go. So here on the liver, it makes bile and then it's stored in the gallbladder, which then goes to the stomach and the intestines for processing fats and other foods. Our liver also stops cuts from bleeding. So when you get a cut and it scabs over, it's your liver doing its job. Our liver kills germs. It plays a very big role in the immune system, and it breaks down anything that's going to be toxic or harmful to your body. It's this really hardworking, incredible organ, but it's almost hard to appreciate because it's not like our heart or our lungs where we have this everyday physical feature and experience of the organ doing its thing. I honestly thought I knew what the liver did until my mother was in liver failure. And then I just started seeing all of these functions go away. And that's when I truly appreciated how important the liver was. When we talk about liver disease like viral hepatitis, hepatitis B, hepatitis C, we first really need to understand the progression of liver disease. The way the liver gets damaged really looks the same regardless of the disease we're talking about. So whether it's something like hepatitis C, lifestyle-related liver disease like non-alcoholic fatty liver disease or alcohol-induced liver disease, or an autoimmune or what we call cholestatic or bile-related liver diseases, the damage that happens to the organ itself looks the same. So a healthy liver is nice and red and smooth. You'll see two pictures of it here. When a healthy liver is good, it's a stage 0. We grade liver damage from 0 to 4. Generally speaking, we need to use either an ultrasound or something called a fibroscan, which checks to see how elastic or dense your liver is. And you can get these clear stages of liver damage. So as the liver becomes damaged, the first step does tend to be hepatitis, which unfortunately is not pictured here. But all the word hepatitis means is that your liver is inflamed. So hepa means liver, itis, like appendicitis or bronchitis, just means inflammation. So first your liver will inflame, hepatitis, and then scars start to form. This is the natural healing process. If you think about when you get an injury or a cut to your skin, first the area kind of swells and then it's replaced by scar tissue. That's the natural healing process our liver undergoes. So first we see inflammation, hepatitis, and then scars called fibroids begin to develop. As someone enters into fibrosis, these scars can become more and more expansive throughout the liver, cover more of the healthy liver cells, and actually replace those healthy, hardworking liver cells. So stages 1, 2, and 3, we're in this place of fibrosis. And the great thing about that is that fibrosis can be reversed. So if you're able to get diagnosed with liver disease in, say, stage 2 or stage 3, remove whatever that underlying cause is, say it's hepatitis C, you cure the virus, you give your body some nice healthy time, the liver will actually be able to regenerate fully back to a healthy liver. The liver is incredible in its regeneration. We can actually cut a liver in half and get 2 livers out of it, which allows us to do live liver transplants. But the healthy liver and even a damaged liver is able to regenerate and replace healthy functioning cells from where those scar tissues are building. However, sometimes that damage just happens faster than the liver can regenerate. So that's when we step into a stage 4 or a cirrhosis. In stage 4, we are getting to a point where it's going to be tough to kind of backpedal to see any sort of regeneration. Stage 4 is that point of cirrhosis. The thing with cirrhosis, many people hear it and they tend to think about alcohol, but all cirrhosis means is your liver is extremely scarred. You have more scar tissue than actual healthy tissue. So when you have cirrhosis, you will also probably have to start undergoing liver cancer screenings. It's very common for someone to develop a liver cancer once they have cirrhosis. So just keep this in mind as we discuss today these different stages of liver disease: hepatitis, swelling, fibrosis, stage 1, 2, and 3, and stage 4, which is cirrhosis. There are many different types of liver disease. There's over 100 different kinds. Today, we're going to be talking mostly about viruses, but liver disease are also caused by our genetics. There can be autoimmune diseases where, for some reason, our body, our immune system, recognizes the self as an invader and starts to attack it, much the same way we would attack a virus. Alcohol use can lead to liver damage. So can our diet. On the rise in our country right now is something called non-alcoholic fatty liver disease. And this is where the liver stores an excess of fat and leads to the same sort of damage we see with alcohol consumption. I get the question a lot, what can I do for my liver? How do I make it healthy? It's really all about moderation, a nice balanced diet, not trying to do fad diets, just fruits, veggies, grains, protein. Coffee is great for your liver, so don't feel bad about drinking your morning cup of Joe. Don't drink 8 boxes of Joe because I told you coffee was good for it, but 2 to 4 cups a day seems to be a very therapeutic dose of coffee for your liver. Don't throw a ton of cream of sugar in that either, because then you'll get a fatty liver. Medications can also cause liver damage. So can street drugs, chemicals, supplements, vitamins. It's always so important to talk to your doctor or your pharmacist about all of the different medications you're taking, including those ones that we buy over the counter, something like a Tylenol or an Advil or a Benadryl, and any sort of natural supplementation you might be looking into. Always talk to your doctor before you start putting that in your body. There are some supplements out there that can really cause liver damage very quickly and result in some really nasty liver failure. So please make sure you review your medications with your doctors. Now that we've kind of looked over the primary causes, let's dive into viruses. First, I'd like to go over some helpful terminology. I feel that we're all a little primed to talk about viruses right now as we've been living through this virus pandemic of COVID-19. So a virus is a small germ that's made up of DNA or RNA. So you'll hear about DNA viruses or RNA viruses, but there's a little bit of genetic material and then it's covered in protein. What viruses will do, well, they'll enter a normal cell. So in the case of viral hepatitis, like hepatitis B or C, it enters into the liver cell to multiply and produce multiple copies. This can actually kill or damage that cell and make you feel sick. Different viruses attack different parts of our body. So something like the flu or COVID is a respiratory infection, whereas viral hepatitis is a liver infection. That's why it's called hepatitis. We're also going to talk about acute versus chronic infection. I like to think about acute like cute, little, it's small, it's something cute. An acute infection is a short-lived, generally about 6 months when we're talking about viral hepatitis. It's a short-lived infection and it goes away on its own. There's not going to be any medication your doctors will give you. Our immune system is able to quickly defeat this virus. It may make us feel really sick for a little bit, but then it will resolve. For some people, an acute infection can become a chronic infection. So say I get exposed to hepatitis C, in the first 6 months of being exposed to it, my body doesn't fight it off. I would then shift from that acute to chronic infection, a lifelong infection where my immune system isn't going to make it go away on its own. In an acute infection, you can still make other people sick, just like the flu would be an acute infection, so it resolves on its own. You can make it go a little faster if you take certain medications, but not all viruses have that. So acute, we're thinking short term, little, cute. Chronic, lifelong. This is something that generally most chronic infections, some can be cured, some can't be, and we'll talk about that as it pertains to viral hepatitis. Couple more things. Again, we've been hearing a lot about antibodies lately, so you're all primed. But an antibody is something your immune system makes in response to something that doesn't belong. So if our immune system notices a bacteria or a virus or a fungus, it knows it doesn't belong to be there. It's not supposed to be there. So it tries to fight it off. And that fight creates an army of antibodies. This is like a little army of immune cells that's primed to fight that infection again, should it come back. So when we talk about COVID antibodies, we're talking about antibodies that are in your body, and we think it may provide immunity, but we're not quite sure. So some antibodies cause immunity, like the chickenpox antibody, you can't get it more than once, and some antibodies don't. Some antibodies are nothing more than a flag that tells your doctor at some point this body was exposed to this virus and created this antibody. So even after an infection might resolve because it's acute or might be cured because it was chronic, that antibody persists because your body wants to use it like a library, right? It has this library of antibodies so that it can fight that same invader. An antigen is something that your immune system relies on to know that something doesn't belong. So an antigen is a small marker, like one of these little tiny outcroppings on this virus, and it cues your immune system to recognize it as foreign. It uses those antigens to release the right antibody to fight that enemy, or it makes brand new antibodies if it hasn't seen that antigen yet. So we'll talk a little bit about antigen versus antibody. I just want to put it on your radar. And then finally, vaccines. So a vaccine is something that it's a shot, given generally a shot. Now we have nasal vaccines as well. But a vaccine teaches your immune system about different bacteria or viruses and allows your immune system to make antibodies just in case one day that virus ends up in your system. For example, I went to Costa Rica a while ago to do some community service, and I had to be vaccinated against typhoid. I had to take medication for malaria, and that was to prep my immune system in case it started to see these viruses or infections that I don't generally see here. So vaccines are great. Again, let's put it in the context of COVID, because so much of us are thinking about viruses as already. We're eagerly waiting to have a vaccine that we hope will provide immune antibodies for us so that we can be protected against the virus through the vaccine without needing to get sick first. So just some helpful terminology as we go. Just going to do a quick time check. All right, quick overview of ABCs of hepatitis. Whoever names viral hepatitis viruses isn't very creative. They found a virus that inflames your liver. They named it A. They found another one. They named it B. Before they officially called hepatitis C, they referred to it as non-A, non-B, and then they officially decided on C. They're really different viruses, though. They're spread differently. We manage them differently. We can be infected differently with them. So I really want to break these down and make you understand how different these viruses are. So hepatitis A is an acute infection. It's one of those, you get it, you feel very sick, generally could be 3 months, could be shorter, could be longer, but for a couple months, you're going to feel very, very sick. Hepatitis A is a virus that lives only in fecal matter. So like COVID is found in our respiratory droplets, hepatitis A is only found in fecal particles. So one would get hepatitis A if they're exposed to tiny microscopic amounts of fecal matter or poop. I do this presentation in person a lot, and I can't see all of you right now, but I'm sure some of you are going, ugh. It's not that somebody is intentionally consuming fecal matter. It's tiny microscopic amounts. Maybe somebody didn't properly wash their hands before cooking or eating food. With hepatitis A, once you've been infected, you can never be infected again. So if you've had a past infection or if you've been vaccinated, that's a lifelong immunity. Hepatitis B is a virus that lives in blood or any bodily fluid. So hepatitis B can be found in semen, vaginal fluid, saliva. Most people who are exposed to hepatitis B will not develop a lifelong chronic infection. Most healthy adults will be able to resolve it within the first 6 months of it being infected. But there is a small portion of adults, about 5% of people, who won't be able to fight this virus away on their own and will develop a lifelong chronic infection. We can't be infected more than once with hepatitis B. We do build a natural immunity if we've been infected in the past. And because of that, we can also vaccinate against hepatitis B. Hepatitis A is generally a 2-dose vaccine. Hepatitis B was traditionally a 3-dose. They've now made it 2, but you might get one or the other. So both hepatitis A and B can be prevented with a vaccine. And then there's hepatitis C. Hepatitis C is a virus that lives only in blood. It is spread through exposure to infected blood, but it's not even enough to get that blood on your skin. It needs a pathway into your bloodstream. So we call it a blood-to-blood exposure. 75% of people exposed to hepatitis C will go on to develop a lifelong chronic infection. There's about 25% of adults who can have acute or short-term experience with this virus. We don't know how or why. Just because somebody can have that acute experience once doesn't mean if they became infected again, they could fight it off a second time. So it's not a guarantee that your body will just clear this every time. With hepatitis C, we can be infected more than once. you can be infected with Hep C as many times as you're being exposed to it. So prevention is very, very important when we talk about hepatitis C. Additionally, there is no vaccine for hepatitis C. So we can't develop a natural immunity to it, and we can't create an immunity through that vaccine. So prevention and knowing the risk factors are huge when it comes to really all three of these, but mostly hepatitis C. So hepatitis A is a highly contagious and infectious virus. People can spread it even if they don't look or feel sick, just like we're finding with COVID. I am going to make a lot of parallels because I feel everyone's primed in this public health thinking right now. So I'm going to capitalize on it. So let's go through some frequently asked questions with Hep A. Where does it live? Hepatitis A is found in blood, but it's primarily found in stool. And it can live on contaminated surfaces. So it can live outside of the body for months. High temperatures will kill hepatitis A. So boiling or cooking food or liquids for at least 1 minute at a high temperature will kill it, but freezing temperatures don't. Hepatitis A is spread by eating contaminated food or water, or having close contact with someone who is infected, perhaps having sex with an infected partner, caring for someone who's ill with hepatitis A, or using drugs with other people who might have hepatitis A. Is it common? It wasn't common for a really long time. We approved the vaccine for hepatitis A in our country in 1996, and after that, we did start to see cases go down. However, in 2012, we did see cases start to increase. Currently, there are many outbreaks across the United States of hepatitis A. I would encourage you to look at the CDC. They actually have a map that shows the different states that are experiencing outbreaks. Some outbreaks got so big, for example, San Diego had to actually bleach the streets because the virus was living on the streets. They had such high levels of homelessness with not enough facilities for people to use. So there was fecal matter in the street, and this virus was spreading very quickly. So really important to know if your community is currently having an outbreak, and if so, you should definitely think about getting vaccinated. Will you know you're sick? So not everyone with hepatitis A is going to have symptoms. We can infect other people before we look or we feel sick. Adults are more likely to feel sick than children. And if you think about children and maybe how hygienic or not so hygienic they are at times, it's easy for children to pass hepatitis A along to one another. So we do encourage Hep A vaccine in children. Symptoms generally appear between 2 to 6 weeks after you become infected, and it might include jaundicing, yellowing of the skin or the whites of your eyes, loss of appetite, feeling nauseous, throwing up, having diarrhea, having really just achy fever, joint pains, and feeling really tired. It's like the flu, but a very severe flu. Hepatitis A is going to be diagnosed through a blood test, and the treatment is really just rest, good nutrition, lots of fluid. Symptoms are usually short-lived. They'll last about 2 months, but some people could feel sick up to 6 months. So this can be a long infection and just feeling sick for a while. If you think you were exposed to hepatitis A, say you're at work and you find out a coworker had it, you can prevent the infection from taking seat. If you have 1 dose of the hepatitis A vaccine, you can prevent that infection, but you have to get that dose within 2 weeks after being exposed to the virus. What can we do to prevent it? So hand washing. Hand washing is so important in so many ways. Soap and water, 20 seconds, sing the ABC twice. There's so many fun ways now to make sure you're hand washing properly. Making sure you're eating food that's been prepared in a sanitary way. Know where you're getting your food from. Check out the health grades of different restaurants. If your state has an outbreak, again, please make sure you receive a vaccine. It's a really good way to prevent this virus. If you do use drugs, never sharing equipment and only using fresh, clean water. So never utilizing any sort of water from a toilet, the tank, or the bowl. And then using a barrier for oral and anal sex, as there is that risk of fecal to oral transmission. And finally, who should consider being vaccinated? These are recommendations from the CDC. So children under age 1, people who are traveling to countries where maybe it's more common, people who have contact with others who have hepatitis A, men who have sex with men, people who use or inject drugs, people with a long-term liver disease. So if you have hepatitis B or hepatitis C or another type of liver disease, you should definitely be talking to your doctor about being vaccinated for hepatitis A. And then people experiencing homelessness. We do see really high rates right now of Hep A in the community of people experiencing homelessness. And a lot of it comes down to close contact settings and just not having access to the right facilities. So I'm going to move on to hepatitis B. If you had a question about Hep A I didn't answer, feel free to put it into that question box and Carla will ask you once we're done. So hepatitis B, about 15 to 25% of people with hepatitis B will develop serious liver complications like cirrhosis, liver failure, or liver cancer. And while I talked about the progression of liver disease early, that you have to go through years of fibrosis, scarring to get to cirrhosis and then get liver cancer, hepatitis B is a leading risk factor for developing liver cancer. You actually don't need to develop cirrhosis first. Just having this virus puts you at risk. So it's a very dangerous virus in and of itself. So hepatitis B, where does it live? Again, I explained earlier, but it's in blood, semen, bodily fluids, and it can persist on contaminated surfaces. So the virus can live outside of the body for at least 7 days. So say there's a blood spill or semen left on a surface, it will stay active for 7 days. The virus has to be in that material that's left out anyway. But a mix of bleach and water is going to be the most effective in cleaning this up. 1 part bleach to 10 parts water. I actually was diagnosed with hepatitis C when I was 10 years old, and I grew up with the virus, and I grew up knowing that if I cut myself and there was a blood spill, I needed to make sure I used the right cleaning supplies to clean that blood up. As we're learning with COVID, not all cleaning supplies are made equal, so please make sure you're using a bleach-based cleaner, if not mixing it yourself. So how's it spread? The infected bodily fluid must enter the body of a person who's not infected. This is very common at birth. So spread from a mother to child, this is something we call vertical transmission. Sex with an infected partner, because again, remember it lives in semen and vaginal fluid. Sharing needles, syringes, or any other drug preparation equipment. Sharing any kind of personal care items. So whether it's a toothbrush, a razor, a glucose monitor, anything that might have those bodily fluids on it. Direct contact with the blood of somebody who has hepatitis B, and then being stuck by a needle or a sharp object that might have a contamination. Is it common in the United States? So cases, again, really declined after we started using the vaccine. We started using our vaccine in, I believe, 1980s. So most people born from the 1980s on in the United States were vaccinated at a very young age. But we actually have been seeing increases in hepatitis B infections as well. These are happening in many states as a result of the ongoing opioid epidemic and increase in injection drug use. And additionally, Asian Americans and Pacific Islanders make up about half of the people living with hepatitis B in the United States. There are very high rates of hepatitis B in many Asian countries, and it's really important that if you are Asian American or of Pacific Island descent, that you're getting tested to make sure you know your status. Will I know that I have hepatitis B? So not everybody has symptoms. Again, these can be kind of pernicious or sneaky viruses. About 40%, so a little bit less than half, will have symptoms from hepatitis B. Most people with chronic hepatitis B have no symptoms at all. So this is kind of a silent virus that can be causing damage without making you feel physically sick. Symptoms do appear an average of 90 days after you become infected, so about 3 months later. They might include, again, jaundicing, yellowing of the skin or the whites of your eyes, loss of appetite, upset stomach, and that achy fever, joint pain, and feeling really tired. Hepatitis B is going to be diagnosed through a number of different blood tests. So I'm going to dive into these a little bit. I'll talk about the blood test shortly because it is important to ask to be screened. So when it comes to treatment, if you have an acute hepatitis B infection, there isn't going to be any medication used. Doctors recommend just rest, good nutrition and fluids, kind of those general R&R rules. If symptoms do appear, they usually last several weeks, but some people may feel sick up to 6 months. If you have chronic hepatitis B, there is no cure for this virus. There's a medication that can slow the progression of the disease and try to help your liver stay healthier longer, but there's no way for us to get this virus out of your body. If you think you were exposed to hepatitis B, say you have a sexual partner who you just found out was infected, or you were at a gathering recently, somebody got a cut, you learned that they had hepatitis B and you had an open wound, and you want to know, you want to try to prevent it. Again, you can actually get 1 dose of the hepatitis B vaccine or a shot called HBIG, hepatitis B immune globulin, and this can prevent the infection. So with hepatitis A, remember you needed to get that 1 dose shot within 2 weeks. With hepatitis B, it's a shorter timeline. You have to see a doctor within 24 hours of exposure. So if you think you had any possible exposure to hepatitis B, do call your doctor as soon as possible. What can you do to prevent it? Receiving a vaccine, if you haven't been vaccinated, it is a very dangerous virus in and of itself. Hand washing, again, with soap and water, and using the right cleanup supplies if there is a bodily fluid spill. Wearing a condom with sexual partners, because it is going to be transmitted pretty easily via sex. Never sharing equipment to use any sort of drugs. And if you have hepatitis B and you're giving birth, we can actually give HBIG to infants born to moms with Hep B, as well as the Hep B vaccine within about 12 hours. And this prevents babies from becoming infected. So we do a lot of prevention of that vertical transmission, because if a baby's exposed to hepatitis B, it's far more likely they will develop a chronic infection. So pregnant mothers should definitely be screened for hepatitis B to make sure that there's no risk of passing this along to their child, especially because we can do something to prevent that. So should you be vaccinated? So really, anyone who's looking to be protected against hepatitis B, all infants should be vaccinated. We call this a birth dose initiative. Children younger than 19 who haven't yet been vaccinated, people at risk of infection through sex, or who has a partner who has hepatitis B, people who maybe be at risk of exposure to blood, whether it's because they inject drugs, they work in healthcare or public safety, they're on hemodialysis treatment for kidney failure, or people with diabetes, because you have all those little pinpricks on your fingers, right? In people who are traveling internationally, again, it's more common in other countries. People with chronic liver disease, especially those with hepatitis C, people living with HIV, and then people who are in jail or prison, because it will spread a little bit more easily in those close contact settings. So some testing, should you get tested? You're sitting here listening to these risks and wondering, should I even get tested? Am I at risk? So if you were born in a country with a high prevalence, absolutely. If you're a man who has sex with men, if you inject drugs, if you have HIV, if you live with or have sex with someone who has hepatitis B, you should get tested. If you're on immunosuppressant medications, you should also get tested, because your immune system is not going to be able to fight that virus off in that acute phase. I apologize if you just heard a train whistle. I live right near the train tracks. If you have kidney disease or hepatitis C, if you have abnormal liver enzymes, again, if you're pregnant, you definitely should be getting tested, or if you're born to a mother with hepatitis B. So what are these tests going to look like? There's 2 main tests that we talk about when we talk about hepatitis B. There's antigen testing and antibody testing. So when we talk about antigen testing, this looks to see, remember, the antigen is part of the virus, right? So a hepatitis B surface antigen test, it might come up as HBsAg on your blood work. This antigen can be detected when someone has hepatitis B, when they actively have the virus. But it can't determine if this is an acute infection or it's a chronic infection. So a person who's testing positive on this HBsAg, that hepatitis B surface antigen, somebody who's testing positive either has acute or chronic hepatitis B and can certainly transmit that virus to somebody else. If they're testing negative, they do not have the virus in their blood. Antibody testing. So a lot of times people will say, I got tested for hepatitis B and it says I'm positive. Does this mean I have it? When we're looking at the antibody, remember that's something our immune system created. So if we're testing positive, it means generally that we're protective. I want to delve into that a little. So there's the surface antibody, and this comes up as anti-HBs, so antibody hepatitis B surface. It's an antibody produced by the body in response to the hepatitis B virus. So remember that antigen, your immune system recognizes that hepatitis B antigen, says it does not belong, and creates this antibody. If you have this antibody, it means you are protected or immune to the virus because you are either vaccinated or because you had the virus at some point and have recovered. So it does mean you're immune. You can't get it again, but we can't tell if you're immune because you were vaccinated or if you're immune because you were infected. Total hepatitis B core antibody, anti-HBC. This is an antibody produced only in response to part of the active hepatitis B virus. So where the surface antibody, you could produce that if you were vaccinated or because you were sick, a core antibody, you're only going to produce this if you're either currently infected or you were previously infected. So where if I were to be vaccinated, I was vaccinated, so I have a surface antibody. If somebody had a previous infection, they would likely have a core antibody and a surface antibody. So if you have a positive core antibody, it means that you are either currently infected or you were infected in the past. You will need to get more tests to see if you have an active infection, should you pop positive on that core antibody. So that's where I'm going to leave hepatitis B. We'll get into hepatitis C. And again, if you have more questions on Hep B I did not answer, please throw it into the question section for Carla. Hepatitis C is a very serious virus. It kills more Americans than any other reportable infectious disease. So this includes HIV, pneumonia, tuberculosis. Since 2007, more people in our country have died from hepatitis C than from HIV. This is a really serious virus that just doesn't get a lot of conversation around it. So let's talk about it. So with hepatitis C, where does it live? Hepatitis C is only found in blood. Hep C is spread through a blood-to-blood interaction, so that infected blood needs to come in contact with your blood. But hepatitis C has a very long lifeline outside of our body. So if there's a blood spill and the virus is, say, on a table, it can live for 3 weeks on a surface at room temperature. But if it's in a closed, wet environment, say a needle, a bottle of tattoo ink, it can actually live up for 3 months in that closed, moist environment. So where something like HIV leaves our body, starts to break down after a little while, we're not too sure how long, but it breaks down pretty quickly. Or even COVID. We've been talking a lot about contaminated surfaces. So they've given us a timeline for cardboard. I think it's about an hour, steel, all these different things. For hepatitis C, it has a long timeline. And again, how is it spread? So it's a blood to blood. The blood from an infected person has to enter the bloodstream of someone who's not infected. This is often done because of sharing needles, syringes, or any other drug preparation equipment. So it's not just the needle, it's any piece of drug paraphernalia that could transmit the virus. Being stuck by a needle or other sharp object that might be infected. It can be spread through birth. That's how I contracted. It's about a 5% chance that a mother will transmit the virus to the child at birth. Again, that vertical transmission. It happens. I'm one of 4, 2 of us got it, so 50%. But it isn't very common. It's generally about a 5% risk rate. Sex with an infected partner. Again, this needs to be a blood-to-blood interaction. So hepatitis C is not found in typical sexual fluids, semen or vaginal fluid, but if there's blood present, it can be spread more easily. Sharing of personal care items, toothbrush, nail clippers, tweezers, razors, again, glucose monitors, any sort of personal care item that might get a little blood on it. Or getting a tattoo or piercing in an unregulated setting. It can live in the ink from one person to the next. There are other, common ways, but these are the most common. Will I know I have hepatitis C? So people with acute hep C usually don't have symptoms, or they might have mild symptoms. Generally, somebody who has that acute short-term infection that's going to go away in 6 months, they might have symptoms that show up 2 to 12 weeks after that. So 2 weeks to, 4 months. Might get yellow skin, might get yellowing of the whites of your eyes, severe itchiness. For me, actually, I had itchiness growing up my whole life, and I never knew that it was because of hepatitis C, but it's like an itch that comes from the inside out. loss of appetite, abdominal pain, generally in the upper right quadrant. So if you imagine cutting your body into quarters, it's that top quarter where your liver lives that you would feel an ache. Fever, joint pain, or feeling tired. The thing with hepatitis C is that most people develop that chronic infection, and most people don't have symptoms of chronic hepatitis C until they start experiencing symptoms of cirrhosis and liver failure. And by then, that's really, really late stages. So, I talk to many people, this is a deadly virus, and people assume if I had it, I would know I had it. But testing is the only way to be sure you have it. Please consider getting tested. Is a comment. So before 1992, hepatitis C was pretty much only spread through blood transfusions or organ transplants. We started doing widespread screening of the blood supply in 1992 when we officially identified hepatitis C and could test for it. So since then, widespread screening of the blood pool has taken place in new organs, and that's really eliminated that source of infection. New infections reported to the CDC, though, in 2018 were 4 times as high as it was in 2009, so just 9 years previously. For a really long time, hepatitis C was seen as this baby boomer disease. You've probably seen commercials that are like, are you a baby boomer? Were you born between 1945 and 1965? That's because so much of the hepatitis C infections we saw in our country were in that boomer population. However, we now see what we call a double bell. So now the millennial infection, young people from in their 20s and 30s have actually increased higher than the baby boomer infection rate. This is again from 2018, these rates. And this spike in the millennials is really largely due to the opioid crisis. As opioid injection and intranasal use increases, we are seeing upticks of hepatitis C. So what can you do to prevent it? Use sterile injection equipment, so avoid reusing or sharing any equipment. If you have to reuse it, mark yours. If you must share, use bleach and sterile water. Really aim for that one-time use. Using your own straw to use intranasally, using your own crack pipe, ensuring sterile tattoo and piercing equipment and single-use ink. Tattooing is very high. And then using condoms and lubrication for sex, avoiding sharing any sort of personal care items, and getting tested. Getting tested is the best way to know if you have an infection and to keep others safe. So the new CDC guidelines just released this year, totally overshadowed by COVID, actually say that every single adult should be tested for hepatitis C at least once in their lifetime. Every pregnant woman should be tested every single pregnancy, and anyone who has ongoing risk factors, sexual partners, injection drug use, tattooing, things like that, should be tested with regularity. But this is very exciting to me, the idea that we should all be getting tested for hepatitis C. That's the only way we're going to remove the stigma when it comes to hep C. So how is it diagnosed? What is this test process going to look like? So it's diagnosed with a blood test. It's a traditional blood test in your doctor's office. You can actually get a finger stick test as well. That gives you results in 20 minutes. But the finger stick test only tells you about antibody. So an antibody test, remember, an antibody is something your immune system made because the virus was in your body. So all it's going to tell you is if you've been exposed. If you have ever tested positive for an antibody, you must request a viral load test. That's going to give you that information you need. So quick little flow chart. First step is that hep C antibody testing. So that looks for that antibody. If you come back positive or reactive, it means at some point hepatitis C was in your body. It doesn't mean that it's still there because that's something your immune system made. If it comes back as negative or non-reactive, it means you've never been exposed to hepatitis C. However, if you had a recent exposure, say you had sex with an infected partner a few days previously, it can actually take between 3 and 12 weeks for that antibody to show up. So if you had a recent risk factor, think about it in your mind and just kind of try to space that out 4 to 5 months after your last possible risk. So antibody test tells us exposure. So like I said, there are some people who can self-clear or have that acute infection, about 1 in 4. So if you self-cleared, you're still going to have an antibody. or if you did medication like I did, I still have an antibody. I'm not a carrier of the virus. I can't make anybody else sick. It just means at some point Hep C was in my body. And remember, it's not keeping me safe. I'm not immune. I can be infected again. So you get this antibody test. You might have to wait 6 months. If it was a recent exposure, your doctor might want to see if you're going to clear it on your own. And then we're going to go into a viral load or RNA test. For me, if I want to know right now, today, do I have Hep C? This is the test that I asked for because I know I'm going to be positive for that antibody. So the hepatitis C viral load or RNA test, this is present. If you're positive, this means that they can actually find the RNA or the genetic material of the virus. If it's negative, it means that you do not have hepatitis C. So undetectable viral load, you don't have Hep C. If you come back positive on that viral load, that number is not a level of sickness. This virus replicates and can get really big really fast. So don't worry if you see a big number on your lab report. It's really so much either having a number or being undetectable. So say you come back positive, you will need to get some other tests. They'll have to do a genotype to figure out which medication will be the best for you, liver function test to see how your liver is doing, and something to stage your liver damage, whether it's a FibroScan, an ultrasound, or a liver biopsy. So how is it treated? And I believe this is one of my last few slides. So hepatitis C treatment has actually changed and become incredibly more effective in the last few years. Current treatment is usually one pill once a day for 3 to 12 weeks. It shouldn't be 3 to 12 weeks. It's either 2 months, 3 months, or 6 months. I so apologize for that. It should be 8 to 12 weeks. So most people can plan on 8 weeks, 2 months, maybe 3 months. In very rare cases, we need to do 6, but it's very, very rare. Treatment access does vary by state, which we'll talk about. The considerations for treatment access are sobriety, liver damage, who's prescribing you the medication, and also once in a lifetime treatment. That being said, hepatitis C is now curable in over 90% of people. We see cure rates between 95 and 100%. To give you a little understanding of how incredible this is. So when we had no treatment, about 15 to 25% of people get rid of the virus on their own. When we first started seeing hepatitis C drugs, this was interferon-based treatments that made people really sick. We saw between 9 and 30%. Then from about the early 90s, 93 to 2013, this is where I fell in. I actually did a drug called pegylated interferon and ribavirin, and my chance of response was 50% because of the genotype I had. 80% was more genotype 3, 50% was genotype 1. Now, it doesn't matter what genotype you have. Everyone can be treated, and most people can be cured. There is no good genotype, there's no bad type, they're all treatable and they're all curable. So really at the end of the day, it's about getting tested, it's about getting treated, and it's about getting cured. I did say there is some treatment access difficulties, but we have groups like NeedyMeds and the American Liver Foundation and other partners that we work with to help you gain access. So a group called the Center for Health Law and Policy Innovation, called CHILPI for short, and the National Viral Hepatitis Roundtable looked at every single state and gave them grades based on how open their access was. So did they require advanced liver disease? Did they require 6 months sober? Did they require a specialist to prescribe this medication? So here you'll actually see the grades. So we're in Massachusetts, I am. Massachusetts has an A, but just above us, New Hampshire has a B. This is because they require some sobriety counseling or length of sobriety before treating. They also only do once in a lifetime treatment. So grade A means you don't need to have advanced liver damage to get on this medication. You don't need to prove sobriety. You can actually be actively using or in new recovery to be treated. And you can actually go to a primary care physician to be treated. So these states have pretty open access. They're going to cover this medication as many times as it needs to be covered. Because, you know, if I had cancer, which is very expensive to treat as well, and I got chemotherapy, and then down the road I got it again, my doctor wouldn't say, no, sorry, we already gave you chemotherapy once. And then as we go down, these states, Arkansas and South Dakota, these are the ones that are going to have very strict fibrosis restrictions. So either stage 3 or stage 4 damage. maybe requiring 6 months sobriety and requiring specialty interaction. So I would encourage you to check out stateofhepc.org and read the full report on your state. So some final thoughts. I get the question a lot, what can I do to make my liver healthy? Don't take a cleanse, don't take a detox. Our liver is a detox, just let it do its job. But regularly seeing a healthcare provider is huge. Making sure that we stay up to date in our healthcare and engaged and an active member of our care team. Making sure we receive health screenings. So something like liver cancer screenings. If you have a stage 3 or a stage 4 liver damage as a result of viral hepatitis or something else, you should be getting regular liver cancer surveillance. Reviewing your medications and any herbal supplements or vitamins with your doctor regularly before you start putting them in your body. Getting vaccinated against hepatitis A and B. Trying to follow a healthy diet as much as possible, fresh fruits, fresh vegetables. The best food advice I've heard from liver doctors is when you're in the grocery store, stick to the outside sweep. So everything that's good for you on the grocery store is on the outside. You got fresh produce, meat, eggs, dairy. When you're in the aisles, you're just going to select more hyper-processed stuff. I will say frozen vegetables are healthy. They're not, definitely choose a frozen vegetable over a canned vegetable because I know fresh produce can be expensive. Reducing or fully eliminating alcohol consumption. A healthy liver doesn't like alcohol, but if you have something like Hep B or C, you're going to cause double damage. Addressing any sort of substance use disorder, and getting emotional support and connecting with your local ALF. The American Liver Foundation was incredibly supportive to me and my family as we went through hepatitis C treatment, as we went through a transplant process with my mother. So it's really important to get the help that you deserve. Please make sure you check out our website, liverfoundation.org. Give us a call on our helpline, 1-800-GO-LIVER. If you are on Facebook, follow us on Facebook at Liver Info. We regularly share different programs. We're on Instagram, Twitter, and if you go online and look up health stuff, please always rely on reliable health sources. Don't just use a WebMD symptom checker. Don't just Google your health symptoms. Make sure where you're getting the information is credible. And with that, I am going to turn it back over to Carla.
Fantastic. Lindsay, thank you so much for that very thorough presentation. And it's really just a great example. I promised everybody that was joining us that not only would and can you guys see my screen? Lindsay, can you see my screen?
Yes,
okay?
we can. Mm-hmm.
Great. That not only, let me leave that up while I chatter on for a second, that not only would this presentation be very informative, and it is, but Lindsay does break it down in ways that we can all understand and really give us tips so that we can be active participants in our own liver health. A couple of other things I want to stress, that you will be receiving an automatic recording in a follow-up email after this webinar. I can't remember if it's an hour after the webinar or tomorrow, but you will get that. But we are also converting this into a video that will be posted on our YouTube channel. And the reason I'm stressing that is because there was a lot of information covered that you may be interested in reviewing or, importantly, sharing it with others. You can also find a copy of our PowerPoint slide decks in that handout section of your control panel. Lindsay reminded you a couple of times, and I appreciate that if you did have questions, you can type them into that question section of your GoToWebinar control panel. And I do see a bunch coming in, which is great. And before we get to those, I also want to remind you that as the American Liver Foundation is there to support your liver health, and we encourage you to follow them on social media, give them a call, or visit their website, NeedyMeds is also here to help support you. We do offer healthcare savings resources, as you know, and the ones you're looking at on your screen can all be found under that patient savings tab that I pointed out on NeedyMeds.org in the beginning of the presentation. And as Lindsay said, rightfully so, sometimes cost of treatment or medication is a reason people can't take care of themselves. So please do turn to us if you're having difficulty affording your medication or if you need access to an affordable healthcare provider. One resource I do want to point out is under that patient savings tab, and you'll see it's the fourth check mark down on this slide. We do have a section dedicated to free, low-cost, and sliding scale clinics. This section of the NeedyMeds website is very robust. It has just under 17,000 clinics. But to make your search easy or easier, we've broken it down into 4 categories. There are medical clinics, there are dental clinics, but we also have mental health and substance addiction clinics. Lindsay touched on that if you are looking for support, that to keep your liver healthy if you are struggling with a substance addiction, to do your best to get the help you need. Hopefully you can check out our clinic's database to get access to a primary care physician, but also a substance addiction clinic that's convenient to you. We also have a category dedicated right underneath that to medical transportation, because we understand getting to and from a doctor or specialized facility can also be a barrier. And since Lindsay did talk a lot about COVID-19, or mention it quite a bit, because as she said, it's on our minds. There's no avoiding it. Yeah. It's there. We also do have a new section under that patient savings tab dedicated to helping people that are experiencing financial hardships or trouble getting access to affording their healthcare expenses. So check out that COVID-19 Resource Center. So let's see what else I've got up here before we get to those questions coming in for Lindsay. We do hope that you can join us for future NeedyMeds webinars. And again, as I mentioned at the beginning of the presentation, you can check out those webinars on the bottom right hand of our homepage on the calendar of events. And there's a snapshot for some of them coming up next month. I want to leave up the contact information for both the American Liver Foundation and NeedyMeds as we get to some of those questions coming in. So one thing I do want to share, and I'm pleased to share with Lindsay, that in addition to some questions coming in, we're getting a lot of feedback from our audience saying thank you for the great presentation. So I wanted to let you know that.
My pleasure. Thank you.
And yeah, and it gives me the opportunity to say that NeedyMeds and American Liver Foundation has built this great relationship, and we actually have convinced them to periodically offer webinars to the NeedyMeds audience several times throughout the year. This is their 3rd presentation for the NeedyMeds audience this year. They do have another presentation coming up in October about liver wellness. But again, if you missed any of the other presentations, check out our YouTube channel, and I encourage you to subscribe. That way you'll be notified when new content is added. And we are working out when we can expect them to visit us again in 2020. So let's get to some of those questions coming in. Here's one you touched upon, Lindsay, in the second to last slide about, you had mentioned all these things to do to keep your liver healthy, and you said, listen, don't do a detox, your liver's doing its own job. But I love this question that came in because I would ask it myself, because we see all information about this is good for your liver, take this supplement, do this detox. So is there anything I can do to take care of my liver, in particular food I can eat or supplements I can take? And I will say this also, we hear a lot about milk thistle.
Yeah. So, milk thistle was long heralded as this cure-all for the liver. Most hepatologists or liver specialists seem to agree that there's no way that this one thing could benefit a virus like hepatitis C and an autoimmune thing like autoimmune hepatitis. I think it's always really important to talk to your doctor if there is a supplement you're considering. The best thing you can do for your liver, like I said, coffee is good for your liver, so that's kind of fun, 2 to 4 cups a day. Broccoli, fruits, vegetables, wonderful for your liver, lean protein sources, and exercise. So if you can actually get yourself moving and grooving for about 30 minutes once a day, your liver is a happy camper. Exercise does incredible stuff for our whole body, but especially for our livers. It really allows it to just get moving and grooving. So, and it's whatever it takes for you to get your heart rate up for 30 minutes. So for me, I have a dog that's half husky and he loves to go fast. So he gets my heart rate going even on our brisk walks. I don't need to be out training for the Boston Marathon to get my heart rate up. So whatever works best for you, and always review those supplements before you even put them in your body.
Thank you so much. And thank you for stressing, for the question, because it's certainly one I would have asked myself. And thank you for mentioning that important piece about exercise. I will take an opportunity to mention I also have a dog right now. His name is Benjamin. And the reason I'm bringing it up is because I'm currently getting exercise while we're doing this webinar because it's thundering outside. And Benjamin is about 65 pounds and almost as tall as I am, which is 5 feet. And he has been trying to sit on my lap because he doesn't like the thunder. So if you hear me gasping for air, that's why. Another question coming in. Oh, an audience member shared that they had hepatitis C and it's cured now.
Wonderful,
To hear it.
congratulations.
That's great. What this audience member is asking is, now that they've been cured, is there anything in particular they should be doing to keep their liver healthy now?
Yeah. So post-cure, do remember that even though you cure the virus, that liver damage doesn't go away immediately. So for me, I was cured in 2008, and at that point, I had a stage 3 liver damage. I really should have kept up with liver screenings, whether an ultrasound or FibroScan, to make sure my liver was regenerating and not getting worse. Talk to your doctor if you are in a stage 3 or stage 4 fibrosis or cirrhosis. Talk to them about liver cancer screenings. But really, once you cure your hepatitis C, if you don't have liver damage, you enter the world of people who never had hepatitis C. As long as your liver has bounced back from that infection, it's really just about following things that would be general good practice for others, reducing or eliminating alcohol, watching what you eat, watching those supplements and vitamins, and staying an active member of your care team. But I would encourage you, I was a little remiss in my own care. I was 21 years old when I finished my liver hepatitis C treatment, so I was done being a patient. But I didn't go get my updated scans. My mother actually had Hep C. She was finally cured of it, and then 3 months out after being cured, she was diagnosed with liver cancer because she was going for these regular screenings. So make sure, if you should be getting liver cancer screenings, that you are getting them, and make sure you reach out to a group like NeedyMeds or another support group that can help with costs, because I know costs can be prohibitive when we talk about imaging tests.
So important. Thank you for that answer, and thank you for sharing the information about your health and your mom's. And I'm going to share something as well, because I think it pertains to the question. I think the last question that we'll get in today. My father actually had liver cancer, and unfortunately wound up passing away of it.
I'm so sorry.
But the reason I'm bringing the reason I'm bringing this up is because the question coming in now says, my doctor said something to me about my liver numbers or functions being high from the blood work he did. What does that mean? Should I be worried? And the reason I sort of shared that little that information about my dad, and it seemed to pertain to the question, is I didn't know, myself, my family, we didn't know anything about liver health, about how the liver works, about anything. And the most important thing is, as Lindsay said, not only stay on top of it, but be your own advocate.
Yeah.
Be the leader of your own healthcare team, and don't hesitate to ask questions. And I'm also mentioning that because we at NeedyMeds, we do webinars on topics like that. The one that's popping into my head now is this year we did a webinar on how to become an empowered patient.
Oh.
So again, if you visit our YouTube channel, check that out and see if I know that there's other webinar related topics that pertain to what Lindsay had said about advocating yourself. But getting back to that question, this person's doctor said something about liver numbers or function. What does this mean? Should I be worried?
Yeah, so generally when we go get our annual physical, I know mine was remote this year, so I didn't have any blood work done. But when we go in person for our annual physical, one thing that's often included in that lab blood work that we might have done is our liver function tests, or a liver panel. What that looks at are 4 big enzymes that have stuff to do with your liver. So AST and ALT are made by your liver. And then there's INR, which is your ability to stop bleeding, and bilirubin, which is your jaundice level or your free floating bile. Having elevated liver function tests on one blood draw is not enough to cause a scare. It shouldn't be enough to result in a diagnosis. It might not even, your doctor might not even point it out. If I had a really bad night's sleep last night, or I had a really fatty meal last night, I would likely have high liver function tests today. These are sensitive tests, and they're really influenced by other things beyond just how our liver is doing. If you have one elevated liver function test, your doctor should be calling you back for another blood draw in the near future to make sure that they're stabilizing back out. One elevated liver function test that's then followed up with another one that maybe is back down in the normal range, that indicates to your doctor something was annoying the liver, but it's not now, so it's okay. I will say I lived with hepatitis C for 20 years. I never once had an elevated liver function test. So if you're going to your annual physical and you're just saying, well, my liver's healthy because my numbers are fine, there's a very big difference between the way our liver is functioning and the damage that's happening to it. So if you are worried or any of these risk factors hit home with you, please make sure you're specifically asking to get screened for hepatitis B or hepatitis C, because that's the only sure way to know your number. You cannot rely on liver function tests as a full image. It's like part of a picture, but not the full picture of how your liver's health is doing.
Thanks so much, and such important information. And thank you very much to our audience for asking those great questions and for participating. That is all the time we've allotted for questions today. Again, if you asked a question and we weren't able to get to it, we will follow up with you via email. But of course, you can always reach out to the American Liver Foundation or NeedyMeds at the contact information on your screen. For now, a big thank you to the American Liver Foundation and especially Lindsay for sharing her expertise with the NeedyMeds audience. And thanks so much to our audience for joining us today. We do hope to see you at future webinars. Thanks again, everyone, and have a great rest of the day. Take care.
Thank you, Carla. Bye-bye.